So my study is about low glycemic index and glycemic load diet in reducing acne vulgaris. So acne vulgaris leads to a lot of impact on the developmental, emotional, and psychological aspects of a person who suffers from physical sequelae of scarring and hyperpigmentation. I mean, let me just move here. Oh, let me see. One moment. And there has been studies showing that there's an impact in relationship of diet in reducing the severity of acne amongst adolescents and young adults. So basically, this is a systematic review that I did, and the population in the study is adolescents. So the present review, however, does not really directly show low glycemic index and glycemic load diet in reducing acne vulgaris. However, it suggests a strong association of high carbohydrate diet in causing the incidence and severity. Let's see. So the significance of the problem is acne vulgaris affects an estimated 50 million of people in the United States, and about 85% of these are in their teens. Amongst the teens and young adults with acne, about 6 to 7% of them have suicidal ideation, which may be due to anxiety, depression, low self-esteem, and overall poor quality of life. So there's a lot of mental health issues with physical attributes. And the cosmetic industry growth grew to 2.3 billion. This was in 2023 data. And there has been a growing interest in low glycemic index, glycemic index and glycemic load diet in prevention and reduction of acne. However, that's not very popular. I really do think that's because it's not really money making, more beauty products is more attractive and more supported by other bigger institutions. So my question is in adolescents and young adults, is a low glycemic index and glycemic load diet effective in reducing the incidence or severity of acne vulgaris compared to a normal diet? I did the A-star model in this systematic review. So here, I was trying to show you guys, one moment. So this is how I come up with my systematic review. I use PubMed, Scopus, Sinhal, Academic Search Complete, Google Scholar, and the school that I attended to, Texas Women's Interloan Library, and I come up with 129 articles, and then I've just narrowed it down all the way to 6 articles with 2 cross-sectional studies, 1 prospective study, 1 randomized control trial, 1 case control study, and 1 systematic review and meta-analysis. So this really shows that there's not a lot of studies out there about this topic, which is makes it even more interesting. So with that, so I'm just enlarging piece by piece what's in my poster. So this is exactly what's in my poster. So these are all the studies that I have come up to. And so one of the studies shows that a positive association of high glycemic and glycemic load diet in relation to the severity of acne among adolescents and young adults. Kutlu et al. Also says insulin levels are more so than glycemic levels influence the severity and acne and incidence of acne vulgaris. Okoro says acne vulgaris is more prevalent among those who consume milk, corn, fried beef, and cake, while prevalence is less of those who eat bananas every day. So this is also a very interesting story because not all bananas have, some bananas have high glycemic index and some don't. Bruce, depending on the variety. Bruce et al., the the AV participants randomized to low GI and GL diet had significantly decreased IGF-1 levels, which has been identified as one etiologic factor in AV development. Kara and Ozdemir says high fat consumption attributed to acne formation, while high carbohydrate intake increased severity. So, and lastly, Sake and Mosenpour 2023 clinical studies showed that low glycemic index and glycemic load significantly reduced AV severity, while 6 observational studies show that individuals with higher severity of acne have a higher glycemic diet. So, so from the literature reviewed, although there is no solid evidence of cause and effect relationship between high glycemic index and glycemic diet and severity of acne vulgaris, the propendence of evidence suggests that an association between diet high in carbohydrate and acne vulgaris. Considering the limited number of studies on this topic and the quality of studies so far available, a need for larger, well-controlled trials with longer duration of assessments is imperative to establish the efficacy of low glycemic index and glycemic load diet. So basically, a healthy and well-balanced diet is as good as a main treatment like taking medication for a disease. Therefore, it's just appropriate to complement current any acne vulgaris treatments with a diet that would reduce its potential severity. And nutritional education has its charm because of the perceived benefits and minimal cost, which can be applied among adolescents and young adults. So this is just like my plan for this research. I mean, like I said, this there needs to be a lot of studies out there that needs to be, you know, in the future. That would be my suggestion, but it is safe to say that we can educate our patients that would come in our clinic to also not only just discuss about like the regimen of the treatment that we're giving them for their acne, but also touch on their like diet and lifestyle. Basically, I have created like a list of what are examples of low glycemic, medium, there's also medium, and there's a high glycemic diet. So then when we educate our patients, we can state examples, like concrete ones. So the green ones are the ones that are low, and then the like golden ones, medium and high, more so. An example of low, for example, if like breakfast, we can, or the popular brands out there, we can tell them which one's which. So like example, cornflakes, which is everybody loves here in America, is like a high glycemic index. Whereas there's also high glycemic index fruits, which are like example, watermelon and dates. But they can, and like banana is, I chose the one that's medium, but there are a lot of varieties out there. I noted like if someone who lives in the tropics, there's such a thing as a red banana, which is a very high index. And there's also like the ones that are, anyway, the green ones too are low glycemic index. So it really depends. And yeah, the list is here. These are my sources. And that's pretty much it. And again, that's my poster. Thank you.